Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Good morning, viewers, and sorry for the delay. Today is another interesting day, and we've got Dr. Look at it very carefully. So I want to firstly welcome you all to another edition of our Cancer Awareness Program in partnership with AIT. Sorry, trying to wake up. In the house, we've got Ronsi Chidebe. Good morning, Ronsi, and thank you very, very much for coming on with us today.
Good morning, Dr. Dennis. I'm really delighted to.
Thank you. Just a quick one. I want to make sure I can hear you very well. Good. So I'm going to give a brief background. Ronsi is a cancer control advocate, which is how I met him. Global health consultant, research psychologist, and the executive director. He's one of the leading voices for advocacy in Nigeria to make cancer control a national health priority. He has been engaged in supporting women battling with cancer, hosting oncology trainings for doctors and nurses, fundraising for indigenous cancer awareness, and he founded the first patient navigation and the first cancer support group in Abuja. I will write stop here because if I continue, this profile will be very long. So welcome today. Ronsi, it's very nice to actually see you. And so let us now have a nice, serious conversation on this issue. So let me start. Is that okay?
Yeah, sure, absolutely. Yeah.
You have been an ardent supporter of cancer survivors, which, you know, immediately I say that is why we're on this platform. Elaborate on some of your key observations over the last few years.
Yeah, thank you very much. I must really commend AIT and also commend you, Dr. Dennis, for the fantastic work that you are doing. I think this is really phenomenal. And to answer your question, the first one is that more cancer survivors are coming out to share their stories. And I think that is what you are doing, which is really commendable. That's a very important, because the reality is cancer is everywhere. People, raise your hand if you have seen any cancer survivor, you know anyone who have battled with cancer. A greater percentage of them who have had cancer. So it's increasing. That's a very critical observation. Cancer incidence is increasing every day. The population of people who are dying from cancer is also pathetically increasing. Awareness is also increasing, but I usually define awareness from two different standpoints. Sometimes people can be aware, but not accurately aware. Because sometimes you hear people tell you that they know that cancer is a killer disease. However, that's not accurate awareness. They don't know the symptoms. They don't know what they can do to reduce their chances of having cancer. They don't know what they could do if they, even though the awareness is increasing, the accurate awareness, it's not really, increasing in proportion to it. Beginning to see cancer as an important, health issue.
Very good start for this conversation because, when we look at the issues that we face as cancer survivors, and I never exempt myself from that. I'm going to ask you, considering the challenges faced by cancer survivors, and in my view, the lack of or inadequate support given in respect of funding treatment. So mental health is a taboo and stigmatization. Can government play at all levels to address these enormous challenges? And when I put it this way, because I cannot be exempt, I emphasize that because I have faced and it's navigating through. So how would the government be able to help us?
Okay, so the government have a lot of role to play in cancer control. This is a disease that it's affecting 20 million, over 120,000 Nigerians, right, for a population of over. So every single year we have over 72,000 cancer deaths. What that means is that over 70% of people who have cancer in Nigeria will always die. This is not the case in other countries like I don't like comparing Nigeria with the US and UK. I always like to compare Nigeria with countries like Egypt, countries like Rwanda, countries like South Africa, Ghana, countries that economically we can really compare our GDPs. In these countries I mentioned, they have really made some significant improvements in building the medical infrastructure to care for cancer. They have also been able to create cancer policies that help to ensure that indigent patients and people in the country are able to access cancer care easily. They have also been able to implement what we call the cancer screening programs. In Nigeria today, we don't have an organized cancer. People get screened when they probably hear one NGO is doing one program or the other. And if you don't provide proper screening the same way we did for HIV/AIDS, we will not catch cancer early. We will continue to diagnose cancer at a very late stage. Government have a very strong role in ensuring, and it's a very simple point about ensuring that the federal government does alone. That is the problem we have. The federal government, the Federal Ministry of Health, look at these policies, but the government, imagine having all the commissioners sit in one table and agree and discuss the cancer control plan and agree, invest in cancer control plan. The problem is that we have a very fancy cancer. It has $1 million from 2018 to 2022 to curtail and control. I'm not even sure was achieved. So we need to learn from the mistakes we've made and ensure that we incorporate state government. State governors should not leave cancer control. And this can only happen if we engage the commissioners so that we can have our women, the day they step in to do the antenatal care, they are cervical cancer screening, breast cancer screening. It's a way to encourage them and it becomes part of them and we can catch cancer. All we need to do is as I speak between cancer and poverty. In Nigeria, if you are diagnosed with cancer, the chances that you are going to be poor is very high. Why? Because it's so expensive to treat cancer. And cancer is just partially covered by health insurance. And thanks to the current Director General, Professor Sambo, who is the current Director General of the National Health Insurance Authority. So we need to be intentional about ensuring that people don't fall into poverty because they are diagnosed of cancer. That is very important. I know the government have what they call the Cancer Health Fund. Unfortunately, the fund hasn't really met its goal, and I'm really, really disappointed that the Cancer Health Fund hasn't really provided a lot of Nigerians with the opportunity, or provided a lot of Nigerians with the second chance at life. I'll close by saying another thing I think the government needs to do is to empower the healthcare workers. You can't get what you can't get what you don't give, right? If the government wants better cancer care, better healthcare, they should be able to train the healthcare workers to have all the right skills so they can provide better care. But if you have healthcare workers who don't have the right knowledge, who don't have the right skills, who don't do research, who don't really, cannot stand at bar with all these countries I mentioned before, then we can have better cancer survivors or better cancer care in the country.
Oh, thank you. Thank you. You actually answered two questions for me, because understanding the challenges to navigate makes a significant difference in writing out the right policies. I think one of the mistakes a lot of people do is they write the policy without the other side, rather than making sure the plan is before the policy. So the plan informs the policy, but they do the policy to inform the plan, and that doesn't always work. Okay, one area that is very key for me, and I actually go on it because I am a research survivor, meaning it is because of research funding that I am able to access a lot of very expensive cancer care. Research in cancer has not been fully explored globally. But when you look at the low and middle income countries like Nigeria, where we're mostly affected with all the complications and this funding issue, what, in your opinion, do you think we need to do to expand research? I'm an education person, I'm a doctor, and I do like research, and research informs plans. So what, in your opinion, do you think we need to do? But if we get that right, we're starting somewhere. If we start to build that and we can marry it, then I think we'll be on. Yeah, you get what I'm saying? Okay,
yeah,
I'm feeling that for you.
So one of my mentors, Professor Ifeoma Okoye, would always tell you that oncology clinical trial, that is oncology cancer research, is a multi-billion-dollar, sector. What that means is that if any country is strategic and invests in cancer research or in oncology research, as the case may be, that country will be ready to have investment in billions of dollars. And anytime she talks about this, I mean in billions of naira and then in millions of dollars, anytime she talks about it, I think, and I just don't really see why we haven't been able to see the reason to really invest in this. The reality right now is that all over the entire country, we have less than 10 clinical oncology trials happening. What it means is that we have less than just 10 drugs that are actually being, that are undergoing research in the entire country. For a country that has over 120,000 cancer cases. That's really a shame, because over like 80 of these trials are happening in Egypt, in South Africa, in Morocco, and many other countries across Africa. And the interesting thing is that when you fix your health institutions, fix your laboratories, right, to the capacity that pharma companies abroad and institutes abroad can really see that you have the capacity to test the efficacy of these drugs. When they want to bring this drug down to your country, these drugs are provided free of charge, absolutely free of charge to the patient in that country. Number two, it strengthens the capacity of the health system, because those people bringing this money, those donors, those research institutes, they have to bring in money to fund the institutions. They have to invest in buying microscope, buying a lot of clinical trial equipment. But the problem is that you have to make a commitment. The problem we have right now is that in the country as it is today, we don't have a commitment to cancer research. The government haven't been able to show commitment in it. I will tell you in specific, and I would like to be disputed about that. In 2016, the National Assembly passed a bill to set up the National Institute for Cancer Research and Treatment. That bill was, pushed by Honorable Mohamed Usman and Senator Mwao Habunga. And President Muhammadu Buhari was gracious enough to sign that bill into law. It became an act in December 2017. And that bill clearly stated how Nigeria can make progress, especially in research. Because other countries, almost all the whole countries all over the world actually have institutes, National Institute on Cancer, but we don't have it in Nigeria. All we have is just a cancer desk that has less than 10 people or even 5 people who are manning a disease that is affecting over 100,000 people. So only 10 people or 5 people are deciding how 100,000 Nigerians will live or die of cancer. So that is the problem. If this bill has been signed by the president and it hasn't been gazetted, it hasn't been implemented, nobody will take you serious in the global scale of cancer research. So the government need to match its words with action. And I really want to use the opportunity to call on President Muhammadu Buhari to really see this as a legacy project. He's going to live in the next few months. What will Nigerians, what will cancer patients, what will healthcare system remember him for? So I think just the same way President Olusegun Obasanjo did several years ago when he set up the National Agency for the Control of AIDS. I think this is really a very key one that President Muhammadu Buhari could pick as his legacy project and ensure that this institute start running. Nigerians are really innovative. We have, hundreds of Nigerians abroad who want to bring funding into this country, who want to bring research grants into this country, but there is no proper institutional framework.
That because you've already given me a lot to think about, and I think a lot of Nigerians have a lot to think about. And the last question has to do with private sector. The international and private and NGOs support cancer patients across the country, and I give all kudos to them. And I stand as a survivor and I say thank you very much. We really do appreciate the work you're doing. I'm interested in knowing about how the data supports this funding, as I'm very unclear with the way it's the system seems to frustrate us, because if as a cancer survivor who has an agency, even to access a lot of things, you've got to jump so many loopholes. And I'm like, why do I have to jump this to help other people? And then you make, that's what I'm trying to get at. We don't need to do that. We're trying to do something to help others. So we want to see what that is, even though we know some people abuse systems, but majority don't.
Yeah, absolutely. Yeah, I think I would really start by saying that the private sector are doing some silent, phenomenal work, and they should be encouraged. I am aware that Access Bank, through ACT Foundation, have invested, millions of naira into.
Dr. Denise Ejo, the CEO of Commod Cancer Foundation. I would like to welcome you to our Commod Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers,